go from there. All right, welcome everyone. I have 2 o'clock, so I think we'll go ahead and get started. Our webinar today is on resilience and self-care during stressful times. We know that stress can be challenging to our physical and our mental health, and today we will present ways you can build your resilience and practice self-care. Our program is being recorded and will be available on our website within a week. And as a reminder, all of the lines are muted. You are welcome to use the chat box for questions, which will then be answered at the end of the presentation. And we are privileged at DPC to partner with the American Psychological Association for today's program. And Jewel Edwards-Ashman, a senior editor at APA, will introduce our speaker. Jewel?
Hi, Kathy. Thank you, and good afternoon, everyone. So happy to be doing another webinar in partnership with Dialysis Patient Citizens, and happy to have Dr. Maureen O'Reilly-Landry back to share her expertise with us. Dr. O'Reilly-Landry is a clinical psychologist, psychoanalyst, and couples therapist. She's also an expert in medically induced psychological trauma and the psychological and interpersonal aspects of modern medicine, having edited and contributed chapters to the book, A Psychodynamic Understanding of Modern Medicine, Placing the Person at the Center of Care. Dr. O'Reilly-Landry has worked extensively with patients on chronic dialysis and with organ transplant recipients. She also works with parents of medically ill children. In addition to founding and serving as co-chair of Medical and Addictions Working Group of the COVID Psychology Task Force, established by 14 divisions of APA, she also runs a private practice in New York City. I will turn it over to you, Dr. O'Reilly-Landry. Welcome again. Thank you.
Yeah, thank you to Jewel, Kathy, and Hannah. I really appreciate being invited back again and having the opportunity to give another webinar for you. And I want to thank all of you at Dialysis Patient Citizens and the APA for all of the important work you're doing during the pandemic, but also long before that. Now, before we get started, I want to say a little bit about the COVID Psychology Task Force. We're a group of psychologists trained to understand and deal with psychological trauma. There are various groups within the task force, and I co-chair the Hospital Health and Addiction Patients and Families Work Group with Dr. Patricia O'Gorman, who's an addiction and trauma specialist, whereas my area of expertise is within medical and health-related issues. We have a website, resilienceandcovid.us. If you can see, it's going across the top of the tree there, where we have informational, educational, and training resources related to the psychological stress and trauma of the pandemic, particularly related to staff, patients, and families in medical and addiction settings. And we have a blog under Psychology Today, which is called Psychological Trauma, Coping, and Resilience, COVID-19 and Pandemics. We have nearly 50 articles now written by members of our group. Each article gives tips for coping during the pandemic and contains links to additional resources on the topic of the blog post. I encourage you to make use of both of these as follow-up to what I'm going to present here. So today, I'm going to direct what I say to 3 groups. The first group are the people with chronic kidney disease, including those on any form of dialysis, whether it's in-center, home hemodialysis, peritoneal dialysis, as well as those with a transplant. But what I'm going to describe can apply to anyone dealing with chronic illness. And then there's the social network of the person with the illness, especially ones who are in the role of caregiver, as this has its own set of stresses and feelings that typically go along with the role of taking care of someone else. The final group is the medical and support staff who experience their own set of feelings and reactions when working with patients who are suffering in some way. I'll describe some very common reactions that they might have. So I've spoken a bit about the fact that having a chronic illness, being a caregiver, whether a family caregiver or a medical one, can be extremely stressful. And then suddenly, as if life wasn't already stressful enough, a pandemic hits and literally the entire world closed. In March 2020, when COVID hit, the world shut down and there were so many losses, even beyond people getting sick and dying, which were tragic. We frequently lost our old lives in so many ways. In many cases, we lost the structure to our day, and we lost access to the activities that made us happy or helped us to cope. Sometimes it left us home to do things that weren't very good for us at all, like eating junk food and drinking too much alcohol. One of the big things that many people lost were things that gave meaning to their lives, going to college, attending a prom, or watching grandchildren grow. A huge part of the pandemic was fear. Fear was everywhere, and it still hasn't gone away. Now there's Omicron to contend with. And of course, for those who have a pre-existing medical condition or have a transplant and are immunocompromised, the sense of vulnerability you may already have felt got worse. And there was fear of exposure to COVID for those patients who had to go into the dialysis center. And the worry that families and caregivers felt got worse. And the people working in the dialysis units and hospitals now had to wear protective gear because of the possibility of exposure to the virus. Fear for themselves and fear that they would take it home with them and maybe infect someone they loved. Some were so concerned and worried that it led them to quit, which placed an even bigger burden on the ones who were going in. Now with Omicron, the staff, things have improved, but frequently when the staff is testing positive because it's so much more contagious, even though it's not, it doesn't lead to the type of hospitalization that the Delta variant did. But the staff is testing positive more frequently, meaning they have to go home even though they may not feel very sick. And then once again, there's burden on those who remain working. And on top of having more stress is the fact that we now have had to be isolated from the very ones who might comfort us, or we might be able to comfort ourselves. Social connections are so important during hard times. Just being in the presence of other human beings can cause people to feel calmer. However, in other cases, it wasn't isolation and loneliness that was the problem. Instead, since people couldn't leave home, there was forced togetherness, creating stress in couple and family relationships. Sometimes, though, the new normal was experienced in a more positive way. Some people with illness felt finally understood because they had already felt vulnerable and fearful because of their illness, and it felt good to them that other people finally understood what they had been going through all along. Now, I spoke about the effect of the work on medical and support staff. There's a condition that was first recognized in psychologists who worked with people who were experiencing the aftermath of psychological and emotional trauma in their lives. They labeled it compassion fatigue because it seemed to come from constantly feeling compassion for people because of their suffering to the degree that it became an overload. The normal reaction was just to shut down. They just had no more compassion to give. Now, compassion fatigue occurs when psychological or medical professions professionals, and I would like to extend that to even non-professionals who take on the suffering of patients who have experienced extreme stress or trauma. Dr. Charles Figley, who has researched compassion fatigue, he's the head of our COVID psychology task force, and he said that compassion fatigue is an occupational hazard that any professionals who use their emotions and their heart can fall victim to. Compassion fatigue is the effect of the healer who is trying to heal others. It's like a dark cloud that hangs over your head, he said, and goes wherever you go and invades your thoughts. Another psychologist, Dr. Heidi Alsbach, said, being overwhelmed with the feelings of others can feel like drowning. Feelings of helplessness or hopelessness, irritability, anger, sadness, numbness, detachment, and ruminating about the suffering of others, feeling angry towards the people who might be causing the suffering. Now, during the pandemic, there's been a compassion fatigue for medical people, but actual trauma for them as well. This became a big concern that we had for the frontline professionals in emergency rooms and intensive care units, and others working in hospitals that were overloaded with COVID patients. They were being traumatized themselves by seeing all these sick patients in need of ICU beds, and sometimes there wasn't room for them. In fact, it was this concern for them was how our work group in the task force got started. My husband and son are both physicians. My son was just an intern at the beginning of COVID. Both of them were working in New York City Medical Center in March of 2020. So this is why I have a particular personal interest in wanting the needs of all the medical and support staff in medical facilities to be addressed. They're human beings too and deserve consideration and care. In one of the articles in our task force's group blog, Dr. Sophia Palsdottir writes about the mental health issues that medical doctors can experience. And she writes, attending to providers' mental and emotional health cannot be She wrote, attending to providers' mental and emotional health cannot be overemphasized in a world that often expects doctors to be stoic and showing little emotion seen as a virtue. So stress can affect our mind, our bodies, and our relationships in different ways. For the mind, it can result in experiences of depression, anxiety, anger, resentment, negative thinking, hopelessness, despair, racing thoughts. All of these can be symptoms of stress. And then with regard to the body, the most common ones are feeling nauseous, sick to one's stomach, gastrointestinal problems, body tension, insomnia, a racing heart, panic attacks, skin problems such as hives. Sometimes emotional pain gets expressed as physical pain. And then relationships. The most common problems are anger, conflict, withdrawal, blaming one another for the problems. So it's not just a person who's coping with an illness, but it's actually an entire system that reacts and experiences the stress. And when people are stressed out and potentially anxious, sad, depressed, angry, guilty, that can cause conflicts and problems in relationships. This is not necessarily what I'm describing here feeling stress, stress is not necessarily a bad thing. I'm just describing what might potentially happen. And as the webinar progresses, I'm going to give you some ideas about what to do about it and how to handle it. So, in our blog, we have many articles on self-care, managing stress, coping during the pandemic, and on parenting, managing relationships, and we give concrete tips for making things work. The article with the most views by far is one written by Dr. Robert Gordon, titled, How to Improve Communication with Your Partner. So clearly, if this is an issue in your own life, you're in good company. I'll be giving a brief overview here, but you can follow up with articles in the blog. And the basic theme of this webinar is that taking care of your mind, body, and relationship is the path to resilience. So I am going to be talking about resilience, but first I want to make it clear what resilience is not, because there are a lot of misconceptions about what it is and what a resilient person looks like. Here is what resilience is not. It is not puffing it out. Being resilient doesn't mean keeping a stiff upper lip and pretending that you're not upset when you really are. It doesn't mean never feeling anxiety, fear, or emotional pain. And it doesn't mean not crying, feeling sadness, or grief. So now I'm going to talk about what emotional strength really looks like. Resilience is a psychological quality that enables people who've experienced a tragedy to be knocked down, but come back at least as strong as before. And I want to make a comment, which is that it doesn't have to be an acute kind of situation, because with chronic illness, it's it's an accumulation. It's something that one has to deal with day to day. But the ideas are still the same here. Now here's a Japanese proverb that tells us what resilience might look like. Fall 7 times, stand up 8. Now that's certainly down to earth and tells us what resilience looks like from the outside. I want to describe, though, what makes for a resilient person from the inside. Resilience is, as I list here, a skill that can be learned. Resilience is knowing your own strength. It's being able to ask for help. Resilience is having compassion for yourself. Resilience is what helps us to grow stronger in vulnerable places. And resilience is protective against burnout and depression. So resilience is a skill that can be learned. You don't have to be born with it, and if you don't have it, you can learn it. Also, notice that it doesn't say, pull yourself up by your bootstraps. Instead, it says, ask for help when you need it. Make use of the resources that you have in your life. And this includes the staff in the dialysis unit or any of your medical people if you are not on dialysis. It says it's very important to get to know your strengths, but it's also important to know where your emotionally vulnerable places are so that you can direct your attention to them in the interest of making them stronger. When you're acknowledging your strengths and vulnerabilities, have compassion for yourself. Don't criticize yourself simply because something didn't go the way you wanted it to, or you screwed up with something, or don't take it on that this bad thing, whatever it might be, has happened to you. These things are simply human. And to be able to acknowledge these human qualities in ourselves can protect us from burnout and depression. This is not always easy to do, which is why it's important to be able to ask for help. I do want to make an important point about individual differences. We have a tendency to compare ourselves to other people and judge ourselves negatively, or another person negatively, and then to draw conclusions about whether they or we are strong, weak, etc. However, it's important to know that one of the reasons people have different reactions to the same event is because that event, while it might look the same to the outside observer, can mean something very different to each of the people. For example, imagine two people, both the same age, both healthy and happy. Then they both develop the same illness, and it leaves them both with a mild wobbliness in both legs so that they can walk, but they're a little bit shaky. One of these people becomes extremely depressed, while the other is not happy about the condition of his legs, but he just goes on and remains pretty happy in his life. Now, there might be a tendency to judge them and think the one who didn't get upset and just went on with his life is strong and maybe even a superior person. After all, they both had the same illness with the same symptom, right? Well, in these cases, it turns out that one of them was going to school to study the violin with the dream of becoming a concert violinist. But the other one was an aspiring Olympic gymnast. I probably don't need to tell you which is the one who got depressed and which one didn't. My main message here is that when it comes to psychological issues, there's no right or wrong way to feel. It doesn't make any sense to judge yourself or someone else, since a lot goes on beneath the surface that we can't see. And often, people judge themselves harshly. A very big part of self-care is self-compassion. That's what resilient people do. They treat themselves kindly. Self-compassion is something I will speak about more also in a little while. Now, what I will be discussing here is general and a bit abstract because I'm addressing a large number of people. So each one of us must figure out how these ideas apply to us as unique individuals. So for each point you hear, ask yourself, how does this apply to me and my life and my situation? It's only when we know ourselves that we can engage in the best self-care and do what works for us. Now, back to the issue of suffering. There have been many people over the years who've suffered and written about it. I've always liked the very wise and very much to the point advice of Winston Churchill, the Prime Minister of England during World War II. His advice was short but powerful. When you're going through hell, keep going. Really, when things are at their worst and you feel your life is hell, this is not the time or place to stop. Think of Winston Churchill's words and get yourself out of there. Today, I'll give you some ideas about how to do that. Now, another very different but still very wise man provided an altogether different perspective. His hellish experience also came from his experiences in World War II, but were quite different. He was a Jewish psychiatrist who survived being interned in a Nazi concentration camp. In a book he published afterwards in 1946 called Man's Search for Meaning, Viktor Frankl said, "Life is never made unbearable by circumstance, but only by lack of meaning and purpose. He had this insight when he was in a hell that he couldn't physically escape. Now, although the circumstances are naturally different, people do sometimes describing a chronic illness in a similar way, that it's something they can't escape. What he is saying, Viktor Frankl, is that it isn't even the actual circumstance itself that is what truly makes it hell. Rather, it's whether one has a sense of meaning and purpose in their lives as one goes through it. The Olympic gymnast I described earlier became depressed because his medical problem took away his sense of meaning and purpose. So his job then the work cut out for him would be to try and find new meaning and a different sense of purpose. And that's another point that I really want to make. It's a really good thing to reach out to other people, as I have said, and that includes, going for counseling or therapy, because, we're not born necessarily knowing how to deal with these things. Now, I've written 6 aspects here of resilience that are important in your effort to build one's own resilience. So there's self-knowledge, both feelings and strength. Each one of these I'll address separately. Supportive relationships, including a sense of community. Self-compassion, looking for the positive and the possible. Flexibility, and purpose and meaning. So first, self-knowledge, feelings and strengths. It's important to be aware of your own individual strengths, not what you think they should be or that you wish for, and not what someone else's strengths are, but look within yourself to discover where your strengths lie. So maybe you can ask yourself, what are my personal strengths? Now, feelings are an important part of self-knowledge. Knowing your own feelings is actually a strength, big strength. States of mind like fear and anxiety and emotions like sadness and anger are all there for a reason. We need fear because it tells us where the dangers are. If we weren't able to experience fear, we'd be constantly putting ourselves in dangerous situations. And we need anger because that gives us the strength to fight for what we need and deserve. Each one of our emotions serves a purpose, which is why it's not a good idea to try to get rid of them, ignore them, or try to squash them down. Instead, invite the feelings in so that you can appreciate them and the purpose they serve. Unacknowledged emotions and denied emotions, repressed, can lead to problems. Repressing emotions can even result in physical symptoms, including physical pain and some illnesses. We need to know what they are and then express them in a way that enables them to serve their purpose, and that's good for us. Dr. Tara Brach is a psychologist and meditation practitioner. She tells us how to deal with feelings so that we can feel them without feeling overwhelmed by them. She calls this RAIN, R-A-I-N, recognize, allow, investigate, and nurture. You can even try this right now just to see what it's like. If you choose to do this now, though, think about a time when you felt an emotion, but choose something that's not too strong or overwhelming for this purpose. Maybe about a 4 or a 5 out of 10 in strength. Something that you're aware of, but not too upset by. So recognize, when you feel something coming up, the emotions often begin as sensations in the body. feeling in the stomach, in the heart, a tightness in the chest, just permit yourself to stop and pay attention to yourself and see if you can name it. It's okay if you don't have a name for it. And then allow. Don't push it away, but rather just allow it in and notice it. Give yourself permission to acknowledge that it's there. If you do get the feeling that it will be too difficult to do that, then also allow yourself to stop this for right now and return to it at some other time. That's fine too. The point is to be able to stay present and observe yourself and noticing that you feel overwhelmed is doing exactly that. Then investigate. Once you've gotten comfortable having the feeling and allowing it in, get curious about it. It's there for a reason. It's telling you something, and that's to your benefit to pay attention to what it has to say. Whatever the feeling is, just allow it in, and then when you feel comfortable doing so, start to explore it. Notice how it feels, where you feel it. Are there thoughts that go through your mind associated with the feeling? And finally, the N is for nurture. This feeling is your friend, and so treat it that way. That may feel like a very strange instruction because we frequently think of some feelings, especially anger, as the ones that get us into trouble if we give in to them. But we only get in trouble when we put them into action or express them in an uncontrolled or reactive way. That's really the important thing I want you to take home from this. It's not the feeling itself that will get you in trouble. Feelings are just experiences that happen inside of people. Now, this whole idea is really too complex to be able to cover right here, but the main points are feelings are important messages to ourselves, so we should pay attention to them and not stuff them down or push them away or pretend they're not there. And feelings we don't allow in are the ones most likely to get us in trouble. Self-knowledge also means being aware of our strengths and weaknesses. And you can say to yourself, these are my strengths, and think back to how they got you through difficult times. For example, maybe you're a friendly person, and this creates situations in which you can ask for help. If you think you don't have emotional strength, that means you're not looking hard enough. Maybe you aren't used to looking at yourself for strength or feeling that you have any strengths at all. But I'd like to point something out right now. It's a strength that you are even here at this webinar. It means you're motivated to take care of yourself in a better way. The second component to resilience is to establish supportive, positive relationships. Think about the relationships you have in your life that are most important to you. Are they supportive? Are you supportive to the other person? If not, do you want to work on them? If you don't have relationships, consider taking the risk to reach out to someone. Maybe just start with saying hello. Now, maintaining good relationships with the dialysis staff, can't emphasize that enough. One important way that nurturing relationships can affect your health is through the kinds of relationships you form with medical treatment team and other healthcare providers. You have many of them in your life now: doctors, nurses, technicians, dietitians, social workers, and others. And that may seem overwhelming at times, but they are also a great resource for you, both for medical information and for support. It can be helpful to try to maintain good relationships and open and clear communication with your team. You'll likely derive great benefit from this. Now, self-care and self-compassion. This is an extremely important component to resilience and much harder to do than you might think. Resilient people treat themselves kindly. They have compassion for themselves. Maybe you're not a person who does this so easily. Maybe you're kind of harsh with yourself if you don't perform perfectly at something or mess up something in public. We do have a few blog articles that address this. There are compassion and self-compassion meditations online, if anybody's interested. Dr. Kristen Neff has a website with information about self-compassion. The website also has audio meditations in which Dr. Neff takes you through mental exercises to help you develop the ability to treat yourself and your mind with compassion and kindness. Now, the quote you see on this slide was from me. If I had time to do yoga, I wouldn't need to do yoga. I'm using this as an example of someone with the wrong attitude. I said this when I was home with 2 young children, and some of the other mothers and I were discussing the stresses we were encountering. We were all complaining that there was too much to do, and this created a lot of stress. So someone suggested yoga. I couldn't imagine how I would be able to arrange the time for a class, even though I did think it was a good stress reliever. So in my frustration, I blurted out, if I had time to do yoga, I wouldn't need to do yoga. This slide portrays what the problem was in how I dealt with the problem of feeling stressed out by so much caregiving. Parenting is another example of where you can find high levels of caregiver stress. If you look at this slide, on the left was my wish, my fantasy of what I needed and wanted to do. Time alone when I could meditate, turn inward, achieve peace and inner tranquility. Of course, that was unattainable because it just didn't fit my life. I was seeing the problem as all or nothing, and since my wish was not possible, I didn't do anything, except continue with my very high stress level. The picture on the right shows what it is I should have done. It's a creative and even fun solution to the problem of not having time to myself to do yoga because I needed to be with my children. I should have realized, because what you see here is a woman with a child on her back as she does upward-facing dog. That was a creative and even fun solution to the problem of not having time to myself to do yoga because I needed to be with my children. I should have realized the perfect fantasy was not a realistic one and given it up. I should have then thought about what might actually be possible, some kind of creative solution. When it comes to self-care, people in caregiving roles, both personal ones and professional, often have trouble focusing on themselves and their needs. It's an important part of resilience to be able to balance caring for oneself with caring for others. Yet this is often a challenge for people in helping professions or who are in caregiving roles. They sometimes have to get over an unrealistic sense of guilt that they may feel about focusing on themselves. They may feel it's selfish, or admitting to have negative feelings about their work. And so again, feelings are part of being human, but sometimes we feel as though that's not okay. What we all need, all of us, is a safe place where we can talk about our feelings without being judged or criticized for them. Being able to reach out for someone to talk to is part of resilience, to be resourceful in getting one's needs met. When I work with people whose role is to care for others, I use the analogy of the instructions that are given on an airplane when they're talking about what to do in an emergency. They say very clearly that it's important to put on your own oxygen mask and be sure that it's working properly before you even try to help someone else. The same is true for caregiving of any type. In other words, when taking care of other people, you must take care of yourself, your mind, your body, and your relationships. It's very important to care for your body. If you have an illness, you may need advice from your medical people about what needs to be done for your particular illness. If you're on dialysis, you have access to a dietitian for part of this, for the diet. Others may have to seek out information about dieting, about their requirements for their illness. The diet for the dialysis patient is very challenging. Sometimes adopting the image of it as self-care rather than deprivation can be helpful. Again, if you have feelings about it, acknowledge them and talk about it. If you're struggling, instead of criticizing yourself, ask your dietitian for help with that part of it, about how to make it work for you. Now, exercise. Exercise is good for everyone. Moving is good for everyone. But it can take some figuring out about what works for you and what will fit into your life. The important thing is to be active. Don't do what I did with regard to exercise. Don't do what I did with yoga and create an appealing but unrealistic fantasy. The goal is just to move. If you aren't used to exercising, then start very small and gradually build up. It's also important to actively look for the positive as well as for what is possible. It's so easy to become preoccupied with the negative, and we're actually wired as human beings to look for problems and to focus on what's negative because that's what enables us to recognize danger so we can do whatever we need to protect ourselves and our loved ones. But when this ability is overdeveloped and we've been doing it too much and for too long, then we have to make a special effort to look for what's positive in our lives. And I want to emphasize the word look. We need to actively put effort into finding what is positive because that often gets overshadowed by the negative. Practicing feeling gratitude for the good things and the good people in our lives is part of resilience. This is how we figure out how to get out of hell. We look for what's positive and what's possible. That's where the hope comes from. Another aspect of resilience is flexibility. Being rigid keeps us stuck where we are and often comes from fear of what might happen if we didn't have total control. One way is to be flexible is to be able to adapt and change course when the situation changes, or we realize the approach we're taking just isn't getting us anywhere. And as with this slide, which says, she stood in the storm, and when the wind did not blow her way, she adjusted her sails. So you can ask yourself, when do I need to be more flexible? Finally, one must be able to find a sense of meaning and purpose. As Viktor Frankl, I mentioned earlier, said, in some ways, suffering ceases to be suffering at the moment it finds a meaning. For some, this is very easy and is found in religious or spiritual beliefs and practices. But it's not always so clear where or how to find one's meaning. In an article I wrote in our blog, I posed the following questions that might help in the quest to discover one's own personal meaning in the pandemic. So I said that the questions may be simple, but the answers may be not so simple. What do I most fear? This may tell you where your values lie. What do I most fear losing? This will tell you what you hold most dear. Has anything brought me comfort or joy? Has the meaning been there all along and I just hadn't seen it? How can I create some meaning now? Now, I'm going to end with the most important message of this talk, one I hope you will take with you. When we get caught up in our own problems, this is very easy to forget. So tape it to your refrigerator or your bathroom mirror or do whatever it will take to hold on to the thought. Your life matters. You are important. Thank you for your time and attention. Be well.
Thank you so much, Dr. Riley Landon. That had a lot of information in it. If you have a question, please put it in the chat box. And while you do, I have a couple of comments that I'd like to share. One of the things that I wanted to share with all of you when I listened to the information about supportive relationships and being in touch with each other, on the second Tuesday of every month, the DPC Ed Center has a telephone support group. It's 3 p.m. Eastern Time, and you're certainly welcome to join us. The group is facilitated by an ESRD patient, and we always have special guests who join, whether it's 1 month it might be a nephrologist, psychologist, social worker, dietitian, the whole gamut. So please join us for that. And I really wanted to comment, I like that whole RAIN idea in terms of looking at emotions. I thought that was great, as well as I really liked all the other the quotes that you had as well. So I just wanted to say thank you again for all the nuggets and the jewels in your presentation.
Okay, well, thank you for the opportunity to share all of this information.
You're very welcome. Looking for any questions, if anyone has any? I think you probably have given us a lot to think about and things to take with us. So again, thank you so much.
Okay, thank you.
Yes, and I'd like to thank everyone for joining us today. Very much appreciated that you shared this past hour with us. We do have a very short feedback form that will come up at the end of the program. We appreciate you filling it out. We encourage you. You're welcome to become a member of DPC. We have different levels of membership, so check that out. And next month we'll be talking about fistulas and grafts with Dr. David Mahoney, so you can join us on February 24th, 2 p.m. Eastern for that program as well. Stay safe and have a great rest of the day, everyone. Thank you for joining us. Bye-bye.